All right, EBV and cancer. So we got a kid who's got a sore throat, high fever, petechia, lymphadenopathy. Infectious mononucleosis is what we think of. So it's going to be a teen with fever, sore throat. He's got the petechia, cervical lymphadenopathy, splenomegaly, positive heterophile antibody. That's the monospot test. Super, super important. If they tell you that he's got a monospot test, then it's game over. Cervical lymphadenopathy is just a common finding as well. And also it's linked with your nasopharyngeal carcinoma. And splenomegaly also is associated with your Epstein-Barr virus. Okay, so Burkitt's lymphoma has associations as well. It's going to be your starry sky 8 to 14 translocation, and nasopharyngeal carcinoma is associated, especially in Asian males, and CNS lymphoma. So these are all associated with EBV. You just have to figure out that it's EBV first. So let's look at a practice question. All right, so we got a 22-year-old medical student coming on from a trip, and he's got cervical lymphadenopathy and hepatosplenomegaly. Blood shows atypical lymphocytes. Very important finding. It's going to be like this little blurb that has like some weird purpley blue stuff in it, and heterophile antibodies are present. The virus is associated with what? It's going to be nasopharyngeal carcinoma. And so what we think here is we got Epstein-Barr virus infecting the B cells, and it's linked to that carcinoma, and also Burkitt's lymphoma. Okay, so this is kind of a young person, 22-year-old. Trap answers. So let's look at some traps like Kaposi sarcoma, HHV, HIV, not EBV. And your adult T-cell lymphoma is caused by HTLV1, not Epstein-Barr virus, and it's not going to be your cervical adenoma. There's no associations between acute myeloid leukemia or myelolymphoma and the viral infection, so it's not going to be that. Wouldn't be your cervical carcinoma. There's no association there, but cervical carcinoma would be associated with human papillomavirus 16, 18, 31, and 33. Chronic infection would be your Hep B and C, and Kaposi is going to be linked with HIV, and so Kaposi is going to be linked with your HIV and human herpes virus type 8 infections. And gastric adenocarcinomas, if that were like an answer, like gastric adenocarcinomas, that'd be associated with like your maltomas. And that's like H. pylori infections. Okay, hopefully this is helpful. If it was, you know what to do. Like and sub and stuff.